Hi, I'm Lawrence Maas, registered osteopath and Doctor of Integrated Medicine working here in Petersfield, Hampshire. And I'd like to talk to you today about a very dear topic of mine which relates to the adrenal glands, because I know in previous sort of episodes I've talked about the adrenal glands. Well, the adrenal glands holds hands with the thyroid gland. Those patients that basically suffer from adrenal burnout can have a knock-on effect on their thyroid function. You have to understand as a listening audience that when people are going through massive stress, they usually have got high levels of cortisol and they've got usually low levels of DHEA. The problem with that situation is that the person just keeps on getting revved and revved and revved up until such point they'll actually collapse. The key issue is the adrenals, as they burn out, they'll burn out the thyroid gland. The fundamental thing is to fix the adrenal glands and get to actually to the point when you're sort of fixing the actual thyroid. The thyroid needs to have adequate amounts of iodine and tyrosine and selenium, just as basic nutrients, to work properly. If there's a deficiency in the diet of those nutrients, the person's going to suffer from a hypothyroidism. And it's nutrient induced. So those are easy things that people can fix and biohack, as it were. It gets a little bit more complicated when there are deeper consequences of thyroid issues, which is like Hashimoto's and Graves' disease. These are basically autoimmune diseases that have their foundation in an errant gut function, is where I usually look. And as you look at the gut microbiome, you'll usually see pathogenic bacteria, viruses, and fungi that are causing a smorgasbord of toxins that can go into the peripheral circulation, and some of those antigenic molecules can actually dock onto the thyroid gland and then disrupt its function. Now, it can either speed up its function, which is called autoimmune Graves' disease, or it can basically slow down its function long term, and that's called Hashimoto's. But either way, the thyroid gland needs to have proper nutrition, so good sources of iodine such as seaweed, good sources of tyrosine, which is the amino acid, good sources of selenium, which you can get from Brazil nuts, will basically allow the thyroid gland to work properly. And if it still hasn't actually rebooted, then you have to ask deeper questions like, what the hell's going on in my gut? So my top tips for looking after a thyroid that is dysfunctional would be to make sure you've got the right nutrients, of course, which is going to be a source of iodine, usually kelp or dulse. Looking for a source of tyrosine, which is amino acids you can buy in a health food store. Make sure that you're having enough selenium daily, because that's essential for converting T4 into T3 and giving you energy. Selenium is found best in Brazil nuts. And then the other thing is, especially if you're a woman, just stop spraying perfume on your neck. I mean, this is really, really key. This is an often overlooked cause of thyroid problems, is spraying perfume. We see it all in the ads. Everybody gets so influenced by the behavior and adverts, but just stop spraying it on your skin, on your neck. Spray it on your clothes. That's the key. And then the other really top tip for improving thyroid function is get off the fluoride toothpaste. I mean, I'm not an advocate for sodium fluoride toothpaste, but I do know that there was an enormous amount of research basically showing that fluoride was actually used as a treatment for people who have hyperthyroidism. So what happens to people who've got normal thyroids who use sodium fluoride based toothpaste, and those parts per million build up over time, over 10, 15, 20 years? That person's building themselves up for hypothyroidism. So the key ingredient on this one is there are better non-fluoride toothpaste to look after your teeth. Sodium fluoride basically is a bactericide and a raticide. And so sodium fluoride has to be only given to humans in very, very small micro concentrations. And whatever you do never swallow sodium fluoride toothpaste, because it's going to slow down the thyroid function. So the key issue is change your toothpaste, support your nutrients for your thyroid, selenium, tyrosine, iodine, and just make sure that you basically change the way you use your perfumes. I mean, those 5 top tips will start to stabilize the thyroid and make you feel better and more energized.